Traded on two situations in our state, the week-to-week attack of COVID-19, as well as the severe weather events that we had over the past week. Last Tuesday, most of the damage and the tornadoes were centered in central Delaware, in Kent County, outside of Dover, on the way to Smyrna and Middletown. A.J. Shaw, who's here with us again this week, the director of DEMA, is going to talk about that in a minute. We're also joined by Dr. Carol Witte, who's with us again. So we've got our normal team up here today, and just an update on storm response. I did speak with Delmarva Power just before this press conference, and was advised that the vast majority of service has been restored here in northern New Castle County. I know those customers and our constituents have been out of power for several days, and we appreciate your patience with that. Very severe damage with lots of trees down, particularly in western New Castle County, stretching from Greenville around towards the Concord Pike area and even east to the Delaware River. So I believe we had confirmation of a tornado touchdown there on Friday.
We understand that debris removal is
from Greenville around towards the Concord Pike area and even east to the Delaware River. So I believe we had confirmation of a tornado touchdown there on Friday, and certainly experienced significant winds and damage in the city of Wilmington and Brandywine 100 and west towards Newark and Pike Creek. So with that, AJ, you want to give us an update there and where we stand today?
Will do. So thank you, sir. Definitely a very eventful week weather-wise. We had the tropical storm Isaias that came in the week, and then on Friday, knew we had the potential for some severe storms, and had two storms that merged together in the northern part of the state, northwestern part of New Castle County, and really created a rainmaker as well as a tornado. Few areas that the University of Delaware Environmental Office report out on received over an inch of rain in 5 minutes, which is of historic levels. So going back to Tuesday's tornado, we have had 3 confirmed tornadoes in Delaware in the last week. Just so you know, our average over the last 50 years is 1 per year, so very eventful and a very severe week. The National Weather Service has their preliminary reports out with 3. There may be more that they're still looking at. Radar images, they were on the ground here last week one day and also Saturday, as well as we provided them some aerial footage for them to look at that and make their final determination. So on Tuesday, we had the one that came from Kent County up through, northern Kent County into southern and central Newcastle County. Went 29.2 miles, so kind of something that you would expect to see in the Midwest and not necessarily in Delaware. Substantial damage with that. Again, I mean, hundreds and thousands of trees that have been knocked over. We understand that debris removal is one of the huge issues right now, and we're working with our state legislators. We're working with the Solid Waste Authority, with DelDOT, with others to see what, if anything, we're able to do to assist, because it is, you know, we understand people have insurance. We also understand there's a gap there as well. So we're trying to see how we could assist with that. Luckily, with our partners, and when I say partners, I'm talking about the power companies who really did a remarkable job. You know, we had 60,000 power outages at the peak of the Tuesday event. They got those down to just about nothing very quickly. They were wrapping up operations on Friday, and then 2 hours later ramped back up when the system came through northern Newcastle County. Our partners at DelDOT, the fire service, I won't tell you how many fire runs were responded to between Tuesday and then Friday's events for either damage to structures, tree into a house, water rescues, etc. But commendable work by all those responders that were out there. And then let's not forget our volunteer organizations that we work with every day, the VOAD, so the Volunteer Organizations Active in Disasters, the American Red Cross that was able to provide sheltering for several families that had no place to stay and help them, you know, on the path to recovery, as well as the Health and Social Services. Not that they're already busy with the pandemic, but they're helping individuals that, you know, have needs that have a gap right now. So then we go to Friday's event, very quick event between about 5:30 and 7 o'clock. You know, a lot of rain in the Hockessin and Greenville area. Again, a lot of tree damage and another tornado. And again, their weather service is still looking at something a little farther east in the county as well. So, you know, if anything, this is hopefully reinforces a few things for people. When you get the weather alerts, whether it's on your phone, on TV, you know, or radio, you know, seek shelter. You know, tornadoes are not something we want to, you know, take the chance of that it's not going to hit you. Secondly, we ask people, you know, I said a few weeks ago, you know, we got to make sure people are prepared. State works on our plans. We need the individual to do what they can do as well to lower that risk. And then lastly, kind of what I will lead up with, two things is, Kent County, Newcastle County are working with a lot of organizations to try and get help out to those people that need it. Yesterday, we teamed up with a nonprofit called Crisis Cleanup. The number's right there, 844-965-1386. And the emergency manager for the city of Dover, Case Ass, has done a remarkable job working tirelessly the last week. And one thing was, how do we get our heads around who needs help and how do we triage it? Well, that's where Crisis Cleanup comes in. So anybody in Delaware right now could call this line, register kind of what their needs are. There's no guarantees we're going to be able to assign people to it, but between the volunteer groups like Team Rubicon, American Red Cross, and some others are still trying to get in state to help, at least we could understand what the needs are out there and, you know, get a better picture of what's going on. Lastly, we've had a lot of questions about, will this be a presidential disaster declaration? We are doing damage assessment. We've been doing damage assessment since last Wednesday. We have 30 days from the date of the incident to request that through the governor to the president of the United States. There are certain thresholds we have to meet to request that. We are trying, and again, both these incidents are separate. So what happened Tuesday is one incident, what happened Friday is another. But we will go through, we're, you know, doing our damage assessment at the counties and the local municipalities. We're taking as much information as we can from our partners to see what, you know, position paper we could put together to try and, you know, get the assistance to people. And a lot of times, you know, that doesn't come for 30, 60, 90 days, but we're going to do everything we can to put that argument together and then discuss it with the governor as we collaborate that information. So in closing, there's still, you know, over 2 months of hurricane season left. And I think we can't underplay it, especially there's fatigue amongst, you know, a lot of our, you know, volunteers out there and the responders. And, you know, we need to make sure everybody takes this stuff seriously. So, sir, back to you.
Thank you, AJ, and thank you for your team and their good work. And thank you for recognizing all the workers for DelDOT. They did a tremendous job. I was out touring the various damage on Sunday and on Wednesday of last week. City of Dover, we appreciate the partnership there. And we're extremely lucky. The damage that I saw, particularly there south of Dover around Moores Lake. We're lucky that there weren't more injuries and fatalities. We did sadly have one fatality in, I think, the Milford area. And so just take those precautions that are necessary. I did talk to a lot of my neighbors there in the neighborhood I live in Wilmington that got into the basement as they got the warning, and was the appropriate thing as we saw trees fall on houses, and which could have really injured people in a very serious way. So thank you for that. Again, thanks to the first responders, again to Del Dodd and the crews that were out there working so hard over in the heat on Sunday and over the weekend, so that we could get folks back. The partnership that we have with Delmarva Power and getting our roads cleared and opened, and electric back to homes that had lost power. So thank you to all the folks that were involved in that, and thank you to all the Delawareans who were affected for your patience. This is really an unprecedented situation. It's something I haven't seen in my lifetime, the kind of destruction, back-to-back storms like that. We average maybe one tornado a year. We had 3 in the course of a week with the tropical storm that went through and the summer storm after that. So let's go to our data this week. The numbers are looking good this week. Total cases are flattening out. They are continuing to rise. I guess it's 16,000. Still 186,000 negative tests, and while our number of lives lost continues to slow, each life is precious, and we continue to lean into protecting our vulnerable, particularly senior citizens and those in long-term care facilities. Hospitalizations continues to be a strong point where we are down to 35 current, which is one of the lowest levels that we have had since March and the beginning of the pandemic here in Delaware. So we look at the cases across the state, or the positivity, 3.8%. Again, our target is to be under 5%, and so we're moving solidly below that. We're down to 65.6 new cases per day on the 7-day moving average. That's considerably below the gating criteria for quarantines in New Jersey, New York, and Connecticut, which we talk about a lot. That cutoff is at 97, so comfortably below that, and expect to hear that we're once again off the lists in our surrounding states. 7,200 new cases or cases overall in Newcastle County, and staying about on a reduced level of increase. Same with Kent County and Sussex County as well. So we've pushed down the outbreaks that we've seen in Sussex County. Things are starting to flatten out. Again, if you look at the demographics, though, you can see that young adult demographic is where we saw that acceleration in late June and early July, and it continues to increase at a rate greater than all the other subcategories. So again, we need folks that are in that young adult demographic to think about being careful when you're in bars and restaurants, when you're in public spaces, wearing masks, and being serious about protecting your neighbors and yourselves from the virus. Here's our data dashboard. Again, hospitalizations. We've got every one of our indicators on a good 14-day downward improving conditions. Current hospitalizations, again, one of the lowest levels that we've had in the last 5 months. The new hospitalizations, they tend to go down on the weekend, tick up a little bit on Monday, and that's what you're seeing there. Our percentage of people who are testing positive continues on a nice improving condition and in decline. So we're at about under 4% there on our 7-day moving average. New positive cases, again, as I mentioned a minute ago, are decreasing as well. And then you can see the classic peak and then improvement, the flattening of the curve. The little uptick that we saw after once we started opening, particularly in the beach communities. If you look at the 90-day view, you can really see this. Current hospitalizations consistently moving down from the peak of 337 back in the last week of April. Our new hospital admissions tend to be up and down, as you can see in the top middle chart. And then the percentage of people who test positive, again, the peaking, then the decline. The little increase there that we saw back in the June, July, associated with mostly with beach bars and restaurants and people going back to vacations. And then we flattened that curve out nicely and have, again, pushed down the new population. Prove this to be the case that the vast majority of Delawareans, really no matter where, particularly when you're in public, but most places that I run into folks, I see folks following these guidelines. I think that mask wearing compliance is increasing across our country, certainly in our region. It's increasing in the YMCA gym, all retail establishments that I go to. It's increasing to when I go to pick up, take out all retail establishments that I see. I have my mask on, as do the people who are serving me at the counter. I see I have my mask on, as do the people who are serving me at the counter, and the same is true in restaurants across our state. So a couple weeks ago, we disclosed the conditions under which schools could go back into session in September, and the school districts have been really working hard, superintendents and their teams, getting plans put together for their boards. We're clearly in scenario number 2, which is the yellow scenario. 2 of our criteria, the new cases on a daily basis at 56.5, which is very strong compared to where we've been in the last month or so. Our target there for green is to get that 56 number to 10. And our percent positives, which continue to be strong, driven in part, AJ, by your team's work in getting more people tested and the testing that's happening in other venues at 4.2% positive. That's not today's number. Today's number is better yet than that at 3.8%. That's the number for, I want to say Saturday.
Week to week, yeah.
Week to week.
August 1st through August 7th.
There you go. So that's going to be our measure for the schools. Daily hospitalizations comfortably below the gating criteria there, which is 10 new cases, and we're at 4.3. So solidly in scenario number 2. And each of the school districts are in the process of developing their plans, as I said a minute ago, working hard with stakeholder groups. Most districts have large teams of teachers, staff, administrators, parents involved in putting those teams together, and they'll be presenting those to school boards. Most of the boards are still in the
A lot.
Things very tangible to target, and that is to get more children back to school for in-person instruction, and two, to get as many businesses reopened and doing really continued COVID-19 in our state. Federal government, the $600 has expired at the end of the month of July, that and the expiration of the action that we took to hold up foreclosures and evictions, that we've established a $40 million fund using CARES Act funding, thanks to the Congress and the President and our congressional delegation, Senator Carper, Senator Coons, and Congresswoman Blunt Rochester. We used $20 million that went to the state and $20 million from Newcastle County to basically recapitalize the DMAP program, which was a mortgage assistance program created in 2007 when we had the mortgage foreclosure crisis in our state. It was shut down for a while, and now we've reactivated it, along with the DHAP program, the Delaware Housing Assistance Program, for those who need assistance, rental assistance, up to $5,000 for those in an emergency situation, and the resources goes to the landlord, or in the case of a mortgage, to an agreement worked out with the mortgage servicer. And so if you need information about rental assistance or mortgage assistance, you can find it at destatehousing.com/COVID-19, destatehousing.com/COVID-19, a $40 million fund with a $5,000 limit targeted towards families that are having problems because they're unemployed, not able to go to work, not able to pay their rent or pay their mortgage. We have some assistance to get them through what we hope will be a short period of time as we get businesses up and running again. And so our focus, in addition to responding with our agencies to the two severe weather events that we've had over the past week, is to really continue to push the curve down, to reduce the spread of the virus, to improve the conditions here in our state with respect to COVID-19, and we're accomplishing that. And we're accomplishing it mostly because, largely because all of you are paying attention to the guidelines and restrictions. You're wearing masks when you're in public. You're keeping social distancing when you're in public. You're being careful when you go into restaurants to be separate and follow the instructions. And if you run a business like that, you're following the rules and regulations as well. For me, the overall objective, now we have something very tangible, two things very tangible to target, and that is to get more children back to school for in-person instruction, and two, to get as many businesses reopened and doing business in a semi-normal situation, certainly with more normal revenue than before, so that they can be successful and employ Delawareans. So with that, I want to turn it over to Dr. Carol Rattay. We want to welcome her back. She had a couple weeks where we had other guests from the Division of Public Health, and we want to thank Dr. Hong and Dr. Pescatore for their great work and for filling in as we talked more about testing, particularly testing of teachers and school personnel, and we'll talk, AJ will talk a little bit more about that today. So Dr. Rattay?
Great, thank you, Governor. Our numbers are looking pretty good, as Governor Carney just said. Of course, we would like to see our numbers go down. Certainly, we do not want to see increases in our numbers of cases and our percent positive and our hospitalizations. For right now, it looks like we're in kind of a mild to moderate level of community spread. And so again, it's out there, the virus is out there, and it's really important that we do everything we can to prevent spread between individuals, and especially outbreaks like super spreader events. And so I wanted to go over just some of the latest learnings in the research to talk about what we know now to best prevent the spread of this virus. Masks, face coverings. We've talked about them a lot, and we continue to have evolving, growing evidence that says wearing a face covering and wearing a mask is the most important thing we can do to prevent the spread of infection between individuals, to prevent super spreader events. When you look at some of these events, many in different places across the country or the world, these super spreader events almost always involve a lack of face coverings. And as we talked here before, I think one of the best case studies of showing the effectiveness of masks was these two hairdressers who saw 139, they served 139 clients, very close contact between hairdressers and clients for prolonged periods of time. And because everyone was wearing a face covering, the hairstylists themselves and the clients, no one got the infection. So again, face coverings are so very important. There are a couple of updates. In fact, in the last couple of days, there was a study that came out looking at different types of masks. And so I think it's really important to highlight the importance of the different masks and knowing what works the best. Face coverings that have multiple layers of fabric, which is the type that many of us do wear, these are the most effective. In fact, this study showed that these are almost as effective as N95s, which are the high-grade face coverings that healthcare providers wear. So these work really well. Unfortunately, these gaiter types of neckwear, it's just a single layer of spandex. A lot of people wear them while running and put them up when needed. Unfortunately, are not effective. This study showed that these really don't work well. In fact, you may even have an increased spread of droplets with these types of face coverings. So we want to make sure people know not to wear these gaiters to prevent spread, but really wear the type that has multiple layers. It's also very important that it covers your nose and your mouth, and it fits well around your nose and your mouth. CDC, Centers for Disease Control and Prevention, just yesterday put up new guidance around face coverings with valves. I want to make sure people are aware that valves are a hazard in that droplets, aerosols can go through the valve, and so it is not protective or preventive in spread of the infection. Additionally, face shields, which many people like because you can see the mouth. They also cover the eyes, which is good, but alone they are not adequate because they do not have a seal around the mouth and the nose. So important information about that. Also, I wanted to mention medical exemptions. There are a lot of folks who will claim they have a medical exemption to wearing a face covering, but the reality is true medical exemptions are extremely, extremely rare. It would be someone who has a lot of difficulty breathing, maybe somebody with COPD or serious severe asthma, and those are individuals who the science has made very clear are also at very high risk for severe consequences of COVID-19. So we recommend that people with those conditions for which they don't feel comfortable without or wearing a face covering, that they really should not be in public places where they are exposed to other individuals anyhow. I also wanted to mention age. You know, we've talked a little bit about this. The American Academy of Pediatrics and the and the Centers for Disease Control and Prevention have recommended all along kids 2 and up. It's strongly recommended. And what we are seeing out and about, in fact, I just was at the mall recently, I saw a lot of younger kids, 4-year-olds, 5-year-olds, very comfortably wearing face coverings. So we are seeing more and more that this is becoming a norm for children, and want to make sure that people are thinking about that as well. Additionally, A physical activity exemption, a lot of folks think, if you are physically active in a gym or walking around in a gym or even weightlifting in a gym, you don't need to wear a face covering. Really, it's only those who are engaged in vigorous physical activity, which is running, or running fast, or cycling fast, stair climbing fast, where your heart rate is really increased. Those are really the only times when you shouldn't be wearing a face covering, and that's especially when you're indoors. When you're outside and you're distanced, it's fine to walk or bike without a face covering. But we want to make sure that folks who are in gyms lifting weights know that they really should be wearing a face covering, because that is a risky behavior. The World Health Organization recently came up with a really nice document around ventilation. So I wanted to touch base on this. This is, as we have seen over and over again, a really important factor for these super spreader events. And so in all indoor environments, workplaces, schools, churches, anywhere that people are spending time indoors, it's really important to make sure that there's fresh, clean air. And on the next slide, we talk a little bit about HVAC systems, which are really important. A well-maintained HVAC system can reduce the spread of COVID in indoor spaces by increasing the rate of air exchange, reducing the recirculation of air, and increasing the use of outdoor air. It's also very important to check HVAC systems and change filters regularly, whether it's in our home or workplace or churches or any other place where people gather. Also, WHO points out that restroom facilities, the exhaust fans in these are often not fully functional. So it's important to have these checked out as well to make sure that they are operating at full capacity. But the reality is outdoor air is so very important. So above everything, if you can open windows and doors while indoors, please do so. But very importantly, use outdoor spaces as much as possible for all kinds of activities. And finally, I want to touch base on singing, cheering, loud speaking, voice projection, yelling. We've talked about that before, and we actually have guidance in place secondary to seeing some outbreaks related to singing, where it was assumed that aerosolization of these respiratory droplets was happening during these activities, and evolving science is really showing this to be the case. I want to give a shout out to the Wilmington Children's Chorus and Philip Duchette and others who have been sharing with us some of the recent research in this area, which again is showing that yes, spread does happen from these activities. They also shared with us a study that showed certain wind and brass instrumentalists like saxophone and tuba and trumpet also generate aerosols at high rates. And part of the issue with these activities is they're often inside, and they usually do take place for longer than 15 minutes. So you get these aerosols circulating in the air that people breathe, and that causes the problem. But there are things that you can do to mitigate the impacts. And so on the next slide, we talk about recommendations. We certainly don't want to tell people not to sing and or in theater to project yourself, or in churches, or coaches who are yelling. But there are things you can do. Wearing a face covering is the most important thing to do, and again, a recent study shows that singing with a face covering is a very effective way to decrease the spread. Of course, again, we want to encourage at least 6 feet apart. If a face covering is not going to be worn, with these activities, we strongly recommend staying at least 13 feet away from people, facing away from the audience, as well as using a physical barrier, such as a sneeze guard or a face shield to help prevent the spread. Additional recommendations include For wind instruments or other brass instruments, you can use a bell covering on the instrument and a modified face covering for those who are playing these instruments. Voice amplification can be very effective, whatever setting you're in. If you're teaching or coaching, using voice amplification makes it so that physiologically you're not exuding the same amount of aerosol. So that can be very, very helpful as well. Again, we see a lot of coaches who are pulling down their face covering to yell, and that's the exact opposite of what we want people to do. Keep that face covering on and use like an electric bullhorn and electronic whistle instead of these other approaches that can spread viruses. Also, a recommendation that came out of this study we saw was between activities, for example, between choral activities, air out the room for 30 minutes for good ventilation between activities, and that can make a difference as well. So, again, preventing the spread, we gotta stay vigilant, we gotta stay home when we're sick, and wearing a face covering or a mask, again, is probably the most important thing that we all can be doing, as well as staying at least 6 feet apart, especially if we are not wearing a face covering, and spend as much time outside as we can, especially if we are around other people who are not in our household. And with that, I will hand it back to the governor.
Thank you very much, Dr. Rattay. Great information about mask wearing. I say it each week, I think, on our White House calls. Consistently, the message is if you want to flatten the curve, if you want to prevent the spread of the virus, that we need to increase compliance on mask wearing. I hear it, as I've said before in the past, from Republican governors of Florida, of Georgia, of Texas, of Arizona. And now you're starting to see in each of those states their cases starting to trend in the right direction. And, the experts will tell you a lot of that's due to better compliance and focus on mask wearing and social distancing. They are the main tools that we have. Each of us can employ those tools, and we would encourage everybody to do that, to take care of yourself, your family, and your neighbors. AJ, you're going to talk a little bit about testing. Really continue, had a little bit of a drop in testing because of the weather, but we continue to really ramp it up, and it's an important part of our response to COVID-19.
No, thank you, sir. And yes, so testing continues. We did lose a few days last week. I'll talk about that in a second. But this week, again, have about 10 sites up in Newcastle County. No doctor's orders needed. You can make an appointment or show up. The good thing is we are not turning people away, during these events. We've been able to accommodate just about everybody that's shown up really since the beginning. So capacity is good. You can go to de.gov/gettested to find out locations and times that are convenient for you. Kent, Sussex, same URL. You can go to check out, and we got 4 events this week there. Very successful day yesterday in Dover, and I think we're kind of in routine. People know where we're going to be there, and getting some good numbers, weather depending. And that leads me into the next thing. So we did see a decline the last 2 weeks. We lost about 3,000. We didn't lose. We're down about 3,000 individuals last week that got tested. Testing events on Tuesday were canceled due to the tropical storm. Friday's events up in Newcastle happened to be evening events, and they were all closed early due to the severe weather that rolled through. So we have the capacity, we have the events. Unfortunately, we have to deal with the weather as it comes up and causes some issues, but we continue and march on. We're still rotating around to make sure we are able to, get to different communities and, get people tested. The Walgreens partnership's been working very well. Looking in the next few weeks to expand that, and Dr. Rattay will hopefully have some information on that in the next week or so. But again, that will give us just a little wider foundation that we go out there and help get out in the community. And then we continue to develop or to look at new options, and that takes us to the school and teacher testing. So as we announced last week, we are going to be rolling out teacher and staff. So anybody that works in schools that could be there while students are, including bus drivers, other staff, administrations, et cetera, will be tested, have the opportunity to be tested, and then we're going to do about a quarter of them a week ongoing. So, it's good for surveillance and make sure they're done once a month as well. So we have, again, expanded the type of testing. We're going to be using another saliva-based test, so it's very, easy for individuals to do. And it gives us additional lab capacity. So now we have what the public health lab could do, what we're doing through Curative, and now the Vault being the third lab or the third component to that. So exciting to get that off the ground. We know that's been something the teachers and staff of schools have been concerned about, and hopefully that will make it just that much more safer as we get students back in the classroom. So the second part of that, and something we're working on, and it's a little bit moving target, as Dr. Rattay mentioned, and the governor, the schools are presenting their plans right now to their boards to get approval for how they are going to go back. So we are going to greatly increase community testing over the next probably month. It's going to be focused around the school district. So we are going to try and have several days of testing in school districts, depending on the size of the school district, about a week prior to students getting back into the class. However, right now, this is kind of in flux, as we know some school districts are deciding what model they're going with and what date they are going to be going back. So as we get those confirmed through our partners at Department of Education and the districts, we'll be rolling out the schedule. And I want to make sure it's clear that if you are in, Colonial School District, but you happen to be somewhere else the day they're testing there, we don't care where you take your kids to get tested. They could go to any one of these sites. They're going to be open for the community as well, but we are going to be, probably doing 2 to 3 times the amount of testing for several weeks there. So it's going to be a heavy logistical lift, but we're going to be all over the state concentrating on high schools just because they have the footprint to accommodate the drive-through and walk-up individuals. So more to that as we confirm that. Probably have the first 2 weeks planned out by the end of this week, early next week, and we'll share that with you, and also communicate through the school districts so parents see it as they get their kids ready to go back to school. Governor?
Yeah, so AJ, great work. Thank you for your attention. I think it was 3 or 4 weeks ago I said to you at one of our meetings, I want to test every teacher and every member of the school staffs across our state as they reopen schools, and you've got a really good plan to do just exactly that. It's a plan that I think will be easy for teachers and staff to make sure that they get tested, since they can basically do it themselves at home and register with the testing company. We'll have those results in advance of their coming back into buildings, and then we'll test them regularly after that, and continue to focus on making sure that the schools are safe places for teachers, staff, and children. And we think that we can do it. The key is in continuing to win this battle with COVID-19, to flatten the curve, to crush the virus, as I say, is for everybody to help out by wearing a mask, by practicing social distancing, by following the restrictions. And if we do that, we can get our children back in schools. We can get back more to a normal way of doing business in our state. We can open businesses more fully, and we can strengthen our economy and get people back to work. So we're all in this together, and we're going to win this battle together. So with that, again, we thank the media for covering our press conference today so we can talk to our constituents and the people that we work for, the people of Delaware, and answer any questions that you have. Meredith, thanks for being with us again.
Hello. Just to start off, a clarifying question about testing within school staff. Is it required for staff members and teachers to get tested? I just saw has the opportunity.
Yes, so from the state's perspective and public health, they can't make them, so that's going to be something that's up to the school districts. So it's highly encouraged, we'll put it that way.
Oh, okay. So I'm just curious. Again, I know previous comparisons with nursing homes, apples and oranges, but I am curious why the state would recommend nursing home staff but not teachers at this point.
So I believe there's a licensing component to that too. I'm not sure if Dr. Rattay wants to add anything more, but I think it's just, the school districts are the ones that employ the teachers.
And just to follow up on that, does the state plan to publicly track any infections if and when there's confirmed cases in schools?
Yeah, so we absolutely will be tracking, any infections that might occur in the school setting. It's a part of our case investigation work now. For every case, it's one of the questions that is asked. Schools would be considered one of the high-risk settings, and so whether it's the school that might find out first that there's a positive case or public health, we will work very, very closely with the schools, with the school district in responding. There may be times when there's really no need for the public to know. For example, if a person was positive but no one else would have been considered exposed, that's unlikely to be made public. However, if there are exposures and there's reason to make the public aware, we will work with the school district to make sure that people have the information that they may need.
And we've talked about it quite a bit in these press conferences over the last month or more about our contact tracing protocols and systems. Obviously, in a controlled environment like this, those contacts and those interviews are a lot easier to make. It's also something that we're working with the University of Delaware on for similar purposes to identify people who may have been come in contact with somebody who tests positive.
But as of now, there is no plans to have like a running list of schools that have had confirmed cases that would be available to the public?
Not at this time, no.
And then just my last question for the governor. I know there's been reports of the Ohio governor testing positive and then testing negative for the coronavirus. I'm curious how often you get tested yourself and what kind of test you use.
I was tested, I want to say, once. Was back. My son has been working remotely and living with us. He works for a computer science company who actually does work in the healthcare space in Cambridge, Massachusetts, but they've been all working virtually, and so he was home and not feeling well, and so he was tested, as was I, and my test was negative. I believe that's the only time that I've been tested. I did quarantine once as a result of one of the staff who tested positive, and just served out the quarantine. It was not necessary to get tested because I did the quarantine instead.
Has any of your other staff members tested positive? Just to follow up on that question.
Not that I'm aware of.
This is from Amy Cherry at WDEL. Can Delaware afford President Trump's unemployment, which appears to require states to pay for 25% of federal unemployment?
Well, Delaware is going to use part of its CARES Act to pay for the unemployment benefits that have already been paid out. And so we, with our own revenues, can't afford that. And we will be taking out a loan from the federal government for our current obligations and payments that we'd have to make going forward. And so this new action, executive order by the president, is very complicated and frankly unnecessary. That we ought to have had action by the United States Congress. We thank our congressional delegation for working hard for an agreement there to extend within the current framework those resources and that support. It's important support. It's support that's necessary for Delaware families that have been unemployed. Delawareans who've been unemployed have to support their families. We talked earlier today about our rental and mortgage assistance programs for just that purpose, to help those who are unemployed, and these benefits are incredibly important as well. And so we would encourage the Congress to act to build on our current system, which is not nearly as complicated as this, but we don't have the resources right now. We're using federal resources for the benefits that are being paid as we speak. It's just an unnecessary and complicated way of addressing a real need for the people of Delaware.
From Mallory Metzner at WRDE, is there a timeline for Phase 3 yet, and what would it take to get to that point of reopening?
Yeah, so the Phase 3 is an interesting challenge for us. Our major objective, as I said earlier on, is to get as many children back in front of teachers and schools as possible, and we're working on that, and school districts are working on that. Many schools, because of concerns over safety and some of the restrictions, operational restrictions, have chosen to go with fully remote learning. Other districts, like Hip Henlopen, which we highlighted today, have a so-called hybrid model of a mix of remote and in-person instruction. And we want to continue to have that movement from fully remote to a hybrid to fully in-person instruction. And to do that, we have to have conditions on the ground that warrant it. We're almost there, and we're getting there. And so the way to do that is to really lean into the guidance and restrictions on activity that exist. There isn't much that would happen if we went to so-called Phase 3, any changes, but it would send a signal to folks that, frankly, is not the right signal to send now, which is we've accomplished our goal to stomp out the virus, and we can go back to normal now. So it's really a question of balancing that messaging out, the need to continue on pace, to wear masks, to social distance, to stomp down the virus and enable us to bring children back to schools and businesses more open so that they can get revenue and survive, put people back to work. So we have two objectives: reinvigorate the economy and bring children back to school. They're connected, and so that's what will guide our decisions with respect to the remaining reopening that has to occur. And most of that is around, restaurant capacity and gatherings and places that are at the greatest risk of transmitting the virus in our communities.
From Kate Tabling at Delaware Business Times, doctors across the country are hoping for continued measures and insurance reimbursement for telemedicine options, and Delaware has recently lifted more restrictions on telemedicine with a recent bill that you signed. Since many doctors predict that telemedicine will be here to stay, what long-term measures will you and your administration be looking at in terms of telemedicine, as that bill has a sunset provision of July 1st?
Yeah, so we've talked about telemedicine in Delaware for years. Going back to my days as lieutenant governor, when I did a lot of work in healthcare, health disparities, and healthcare costs, and small business health insurance, and the rest. But in the context of COVID-19 and this pandemic, with the risk of transmitting the virus, telemedicine has been a godsend, and it's been incredibly important to the delivery of healthcare services and getting patients in front of physicians safely, particularly primary care physicians, to get a prescription to go and get tested or whatever the case may be. And that's why we, through legislation that I signed, put in place with a sunset certain terms for telemedicine practice here in our state. They will be important practices going forward, and we will look at some of the conditions as that need to be addressed in a long-term basis as the sunset approaches in July of next year. We also have to take our lead for Medicare and Medicaid in terms of reimbursement. As an employer, the state will establish fees that will pay for telemedicine, and we need to think about how that will work and how it can create efficiencies in the delivery of healthcare services in our state. And I know it'll be an important way of doing healthcare services in the future, and we look forward to addressing any issues that occur over the next several months.
From Nick Cialino at Delaware Public Media, are many school districts reaching out to the state for guidance in formulating their plans for the fall?
Yeah, so one of the things that we've done, and I asked Dr. Rattay to comment on it as well, back when we were talking about the conditions under which schools would reopen, partially remote and partially in-person instruction, and as we move into the scenario number 2, the yellow scenario, which is kind of a hybrid model. We assigned individual professionals and experts from the Division of Public Health to work with educators, superintendents, instructional experts and leaders in the schools and school districts to develop those plans and really to focus on the operational challenges that teachers and schools encounter with children. And I think that's been really helpful to schools, and it's been a way that we've been able to provide real good advice to that decision-making. Dr. Rattay?
Yeah, absolutely. We have received a lot of good feedback. Our public health experts who are working with the districts are very busy, meaning that the districts have been spending time working with them, asking questions. And I, in fact, received from one particular district some really positive feedback about the experience. They're finding it very helpful. So we're really glad to be able to support the districts in that way.
From Sophia Schmidt at Delaware Public Media, the University of Delaware is requiring all students, faculty, and staff to be tested within 14 days of arriving to campus. What is the state doing to prepare for what will likely be a surge in testing demand?
So I'll let AJ handle most of this, but first of all, we're trying to ramp up testing more generally to the public. We talked today about testing all teachers initially before they reopen the schools, and then periodically through the month, as well as testing students and children in our elementary and secondary schools. So that's a big commitment in and of itself. We've got employers, the University of Delaware being chief among them, are bringing students and faculty both back on campus, and they'll be tested there. So we do have big challenges, but we also have seen some innovations in testing technology, and we're taking advantage of some of that. So it'll be a challenge, but I think AJ and his team are up to it.
Only thing I would add is that is why we keep on looking for, new labs or new capacity. But it's as we look at the school plan. So, we have to hit all these districts at the right time to make that test effective for that school district as they go back. So it's a map and a logistical lift to make sure we're effective. But, the big thing is as we get those dates, the farther in advance we have information from whether it's a school district, an employer, University of Delaware, the better we'll be able to accommodate them. We don't want people to travel, across the county, but we also know that we only could be so many places in one day.
And then the final question's from Sean Green at WDEL. The DIAA voted last week to suspend sports competition until December. Do you support their decision, and do you have any concerns about Delaware high schools not having competition while club sports continue, and that this could create a pay-to-play model in Delaware?
Well, first of all, I know how important athletics is to our students and our young people generally. As a lifelong athlete and somebody who played 3 sports in high school and 2 sports in college, and I know how important it is to motivate young people to do well in school, to go to school in the first place, and to have a fulfilling life. So I know how hard the decision that DIAA made. I appoint a number of the members. Some of the members are appointed to the board by organizations that they represent, be they superintendents, teachers, members of the public. And I know it was a very difficult decision, particularly in light of the fact that many of the high schools, the focus of much of the sports that DIAA regulates, were going in fully remote, meaning not having in-person instruction. And so there are several ideas that they considered, weren't able to get a consensus around. A lot of that as a result of operational challenges with busing and with practice and all of that. And so I think their decision was based mostly on safety and on the decisions that were being made in states around us. The decision of DIAA was consistent with what we've seen in Pennsylvania, Maryland, and New Jersey. And so in that, I think they've made a good decision going forward. I do think that we need to look at youth sports. I'm not sure we're fully comfortable with the way some of the sports tournaments and competitions are being managed, particularly from the perspective of following appropriate public health guidance, and that will be something that we're looking at. I know DIAA, I know the athletic directors, the superintendents, parents, teachers and coaches, and concerned members of the public, and frankly, your governor will be eager and interested in getting our students, our young athletes back on the field, back on the courts, enjoying the sports that are so important to their lives. And very difficult decision for DIAA. And I think in light of the situation in each of the school districts with respect to remote learning, the appropriate decision at this time. So with that, as the final question, again, I want to thank everybody for joining us today, for following the press conference, and most importantly for what you're doing to help us flatten the spread of the curve, reduce the spread of the virus, COVID-19 in our state. It's still here among us, and so we need to be smart. We need to get tested. Even if you're not feeling sick with flu-like symptoms, make sure you continue to wash your hands and use sanitizer, and most importantly, wear a face covering, a mask when you're in public. Avoid large gatherings where people are bunched close together. When you're in a gym or at a youth sports event, be it a Little League game or a Summer League basketball game, make sure you're wearing your mask and keeping within 6 feet of other fans and your ball players. And if we do all these things, then we're going to get to where we want to be and have our children back in school and our businesses back online. Thank you for joining us, and we look forward to seeing you the next time.